Good morning and welcome everyone to one of the breakout sessions for the 2022 Nebraska Conference on Health Equity. I would firstly thank everyone for just being here today with us. My name is Adila Tawab and I work as the statistical analyst for the Office of Health Disparities and Health Equity under the Nebraska DHHS. Now I am pleased to introduce our session speaker, Susana Privett, who do great work as the data dissemination specialist for the U.S. Census Bureau. Our speaker here will be presenting assessing data using data.census.gov. And after the presentation, we will be hosting a Q&A discussion. During the presentation and after, please use the chat box on your Zoom to input any questions or comments you may have, and we'll gladly address them towards the end. So, Ms. Susana, we look forward to your presentation whenever you're ready.
Thank you so much. Can you hear me okay?
Yes, I can hear you.
All right. Well, I am so happy to be here. I've worked for the Census Bureau since the 2000 census. And my job as a data dissemination specialist is to help data users. So whether you need to know how to find a table, you don't know what topics we cover, you need someone to do some type of training for you or your staff, I am your person. And probably the number one thing you need to remember about me is that all of my services are free. That's right, free. So please make sure that you check the chat because I've added my phone number and my email. And so you can contact me anytime. Either way, I do work 4 10-hour days. So I work Monday through Thursday every week, and I am off on Fridays. So if you reach out on a Friday, I will certainly reach out to you on a Monday. So today we're going to talk about things health related and the data that the Census Bureau collects and how to access that data. I'm going to share my screen. So just give me a second. And let's see, I hope you can all see my screen now. Okay. So I am starting with census.gov. So some of you may or may not have actually visited our website, but this is a site full of information for you. I've already included a link to our health section on the site that you can go to and check out health related information. The first thing, though, I do want to talk about is this main page. We have a lot of tabs across the top, topics, data, places to go on the site, the different surveys and programs. We have 130 censuses and surveys in our catalog. So we do collect a lot of data. Some of the data that we collect is published on our website. Some of the data that we collect is for other agencies and then published on their websites. For example, we do some surveys for the CDC, and then the data is then disseminated on their website. So also, if you scroll down a little bit on the main page of census.gov, here in the middle, there's a box that says Quick Facts. I don't know if any of you have ever looked at Quick Facts. It's actually one of our data tools. This is a great place to go if you're just kind of needing a number. Sometimes you may be working on a report or a presentation. Maybe you need information on population, the number of households in an area. And so you can go to Quick Facts, and this is what that page looks like. You can put in state, county, city, town, zip code here at the top, and then it will pull up, for for example, let me see if I can type in here. Let's see, and as you can see, I started to type in Lincoln, and it starts giving me, because the geography database is in alphabetical order, it starts giving me all these choices because it's not sure where I'm going. So let's just say that I'm going to look at Lincoln County, Nebraska. So here it says Lincoln County, Nebraska, and then the United States. This tool will always default to the United States as the geography. You can select up to 5 geographies, and they will all list here across this page. So if you're looking at 5 counties, 5 cities, a couple of states, a couple of cities, whatever the combination of 5 would be, all of those columns will show up, and then you can look at those numbers. Now, you may be wondering if you can see the different topics that we have. We have population numbers, gender, age, race, ethnicity, housing. You're probably wondering why are these specific topics on this particular tool? That is because the collection that we have here actually comes from the most requested topics, either that people are searching for on our website or that people are calling us and asking us about. The other great thing about this tool is that it gives you the latest data for whichever of these topics you're interested in. So scrolling down, you can see that there's family, living arrangements, education, health. And so here are 2 topics under health: with the disability under the age of 65, the percent in persons without health insurance under age 65%. So these are then the 2 topics that we probably get requested information for more than the other health related topics. So they're included here. So if you have any questions about possibly where this came from, you need a source to cite in a report, you can always click on the information button, this little I in a circle, and it will give you a pop-up. It'll give you some definitions, talk about margin of error. But if you scroll down, it will give you disability data from other sources, how we ask the questions on disability on the American Community Survey. So this could actually be a gateway to getting more information on disabilities if that's what you're looking for. So this little pop-up is a great source of information besides just providing you the citation for your source. Now, as I said, these are going to be the latest numbers. So you might see, for example, foreign-born persons, percent, and then it has a range, 2016 to 2020. That is the latest 5-year data from the American Community Survey. Sometimes you'll just see, for example, here it says building permits 2020. So the latest data is from the year 2020. And then you may see here under housing units, V 2019. So they also include the vintage year of 2019. That's what that means. So there are also, if you continue to scroll down to the bottom of this tool, you'll see that there's sometimes little code letters here, and you can get the definitions of that here at the bottom of the tool. It also tells you at the very, very bottom all the different sources of data. So that's another thing about Quick Facts. The information that's all contained here isn't all from just one source. It's from several different sources. So that's good to keep in mind. And again, important if you're wanting to cite, click on the information button to get that. So let me go back to the main page. So I'm going to scroll back up. Hope I'm not making anybody dizzy. Click. Okay, so now we're back on the main page. So one of the main topics that we need to talk about is geography. Without understanding census geography, I mean, that is the foundation for all of our data is geography. So let me drop a link for our geography page in the chat for you. Let's see. So if you go to topic and then go to geography, it will take you to the main page for our geography program. And the reason it's important to know about this is because this is where you can go to get the definitions of the terms that we use for geography. I know a lot of you are looking for data at a zip code level. Some of you are looking for data at a tract level and some possibly at a block level. So let me talk a little bit about the different definitions for those terms. And I'm going to also show you, as I'm talking about that, we have reference maps for census tracts, tribal tracts, and for blocks. And you can get those from this geography main page by scrolling down about halfway to reference maps and then clicking on the box that says view all reference maps so that you can get the complete list of maps. Then they're sectioned by year. And because we update our geography maps every 10 years, then the latest would be from 2020. And we usually do that right before we take the census. So every year that ends with a 0 is when we take the census of the nation. And so before that, we work on updating all of our maps. So here under 2020, you can see a list of different maps that are available: block, census tract, tribal tract. Under census tract reference map, tracts are probably the most common geography that local governments, nonprofits, any type of organization that's looking for data about the population or detailed information, characteristics about the population is probably going to take a look at tract level data. A tract in an urban area would be about the size of the neighborhood that you live in. So there's quite a number of housing units and population. The population range for a tract is between 1,200 and 8,000. Our tracts are based on population size and not area size. And even though you'll look at a county map, and you'll see that it has tracts of all different sizes. In fact, let me pick one here. Let me just click on one. I selected Holt, and then you're going to get a PDF option for the map, and then click on that. I had to select the state, Nebraska, then I selected the county. And so I'm waiting for the tract map to come up. So when this does come up, you'll see that there'll be different sizes of tracts. Some are small, some are much larger. And so we are trying to keep all of the tracts the same size, and that's population size, between the range of 1,200 and 8,000. And we do that for comparison purposes, so that you could compare tracts in Nebraska to tracts in Colorado or Louisiana, or wherever you were wanting to compare data. You could do that, because then all the tracts are about the same size. Now, when we do update our tract maps, those are done, as I said, every 10 years. And if for some reason there has been a lot of growth in a tract, populations have raised dramatically, we will divide tracts. Again, still trying to keep all of the tracts about the same population size. The same way, if there is a decline in population, we may merge a tract into another tract area, a neighboring tract. So it's really important, if you're doing any type of historical comparison, that you look at the different decades of tract maps to see what the changes were. You may have a tract number that you've been following or collecting data for, and then there'll be a change and that tract number disappears. It doesn't really disappear. It could have been merged, or it could have been divided into other sections, again, to keep the population size about the same. So I'm not having any luck in getting this tract map to come up, but I'll drop a link in the chat so that you can go to this area and pull that up yourself if you'd like to. So blocks are the lowest level of geography that we have. They are in an urban area the size of the block that you live on in a town. They're bounded by streets or highways, roads, just like your block is in your town. Each block, usually there's streets around that, or some type of maybe water feature or something. So they're bounded. Those are the boundaries that we use for a block. Now, a block is important because that is the level that the data that we collect, for example, in this past 2020 census, that data goes down to the block level. You can pull data, state, county, a city or place as we call it, but you can go all the way down to a block level. Now, in a rural area, a block could be miles big, but in a city, again, it's about the size of the block that you live in. Now, the data that you can see at the block level is different than the data that you can see at a tract level. At the block level, you'll have data that actually, to be quite honest, is data that you could figure out for yourself if you sat in your driveway or on your porch and watched your block for 24 hours. You could figure out how many people live in a household. You could probably tell whether they were related. You could guess their ages, their race, their ethnicity. There's a lot of things that you could tell in a block about the population just by observing them. That's the type of data that we collect during the decennial census, and then that's what's available at the block level. Now, tract is different. That's a much larger geography than a block. That's about the size of your neighborhood. So there's quite a few households in a neighborhood. That data is not just what is available at the block level, but that's educational attainment, income, poverty level, a lot of other more detailed information about the population is available at the tract. And that's what makes that probably the #1 geography level that everyone is going to want to look at, because there's so much data, detailed data about the population at that level. Now, zip codes, those are our zip codes, or our ZICTAs, I'm sorry, are a representation of the US Postal Service zip codes. So they may not be exactly as the zip codes of the Postal Service, but they are a representation for statistical purposes for us. So we do try to follow, but because the post office can change their zip code sizes at any time, we are doing a representation of what we have from the Postal Service. So there is some data available that is similar to tract data at the zip code, but it is limited. And so normally your best bet to get a really good overall picture of an area that you're working in would be at the tract level. So I know that you can't give me feedback on that. So if you have any questions or you're confused about what I'm describing, please don't hesitate to let me know. And take a look at the tract maps or the block maps or the tribal tract maps. You'll see that there's quite a bit of detail. You'll be able to see street and road names, railroad tracks, things like that. So if you're planning on doing some type of research and you want to do it within an area, you can see what tracks are within the area that you're searching for. Then you'll have those tract numbers that you can use to pull up the data. Now I want to switch over to our data sources. So as I mentioned before, we have 130 different censuses and surveys. Not all of them are going to have health related information. Again, a lot of the health data that we collect is for the CDC and some other agencies, but we do have the small area health insurance estimates. That's one of the sources where you can get information about health insurance coverage, and that's also at the race, ethnicity, sex, age, and income levels for different households. So that may be a source of data that you've used or may want to use. We also have the American Community Survey, which I was just referring to. That is probably one of the bigger surveys, definitely the survey that that we work on every month in every county in the nation. It's a sample survey. So the 2020 census, we were talking to all the households in the United States. We were counting everyone and getting information for everyone, as opposed to the American Community Survey being a sample. There'll be one household in a neighborhood that gets the survey. And so we ask them to answer questions. There's 40 plus questions on the American Community Survey, everything from what time did you leave to go to work, to health coverage, to how did you get to work, educational attainment. There's a variety of data from the American Community Survey from all those questions that we ask. Then we also have the current population survey. This is probably our, I believe, the oldest survey. If not, it is one of the oldest surveys that we do. It's really good for providing information on, again, health insurance coverage, uh, child support, school enrollment, um, a lot of information that we do annually and sometimes supplements biannually. Um, so another great resource. And then we also have the Survey of Income and Program Participation, or SIP for short. Now, this is a survey that we do over a 4-year period. So we send out different panels over that 4-year period. So we're sort of following the household. And this is for households that might have government assistance, whether it be food stamps or some other type of assistance. And obviously there's maybe concerns about whether there's health insurance or how they're paying for their health care. So that is covered in the SIP survey. And then because of COVID, we developed a couple of different surveys that we've been doing in weekly and every 2 weeks. One of those is the Household Pulse survey. This is a 20-minute online survey that we ask our respondents to answer. And this is really to tell us how the coronavirus or the pandemic has impacted us and our households across the nation. So there are questions about education, employment, food security, housing, spending, obviously health. So we ask these questions and then we turn around and publish that information. And that is the Household Pulse survey. So really, that is probably one of the surveys that we get the results almost immediately because it is online. But we are doing this with the Bureau of Labor Statistics, the Department of Defense, HUD, the National Center for Educational Statistics and the National Center for Health Statistics, and many, many more agencies. We're all working together to get this information and then get it published online. So I just wanted you just to highlight a few of the different surveys that you might find of interest. And again, those are all health related. So let me go back. So I'm back on the census.gov website. So some of the main topics that you'll see in some of these sources that I mentioned and information in some of the tables will cover health insurance. That's covered several different ways. Disability, fertility, and HIV/AIDS information. Those are probably the top topics that we have. And of course, we have detail on each of those from different tables. Now, let me put the link for the tables. You know, I used to ask why we didn't have a list of all of our tables, and we do now have that for the American Community Survey. So I hope you'll take a look at this, because now let me just say this, we're not known for our table names. So sometimes you may look at a table name and you'll think, that's it. That's exactly what I'm looking for. And you may click on that table and it may or may not have everything that you're looking for. So I do want to say that. But at least this list of table kind of gives you a better idea of what we do have. If you're looking for something and you're looking at our topics, don't forget we have A to Z. Click on that and then go through alphabetically looking for the topic. If you're still not finding it, or maybe you know for sure we don't have that, give me a call, shoot me an email. I may know a different source that you can go to get the information that you need. So please use me as a resource, even for things that you may not find with census data. So I want to talk about data tools now, and mainly I want to talk about data.census.gov. And I don't know if some of you may have used that tool. We did have American Fact Finder, and that went away and was replaced by data.census.gov. And what we're doing, because I used to get this question a lot, not so much anymore, is people would say, you know, why did you do away with American Fact Finder? You know, how are we going to find what we need? But in questioning our data users, you know, and times have changed. Things, everyone wants things to be more Google-like when you're searching. And so that's exactly what we were trying to do, is make changes and updating how you can access data to make that so much easier for you. So at data.census.gov, and let me drop that link in the chat for you so that you can go to that. And then the link for data.census.gov. Let me give that to you in case you're following along. So we wanted to make it much easier for you to access the data. So when you first go to data.census.gov, you'll see this search box at front and center. So, you know, if you're looking for the population of Omaha or something about health insurance, you can type it here, hit the search icon, and it will get you started in finding what you may be looking for. However, I'm going to suggest for most of you that are probably going to be looking for a lot of data or some detailed data, that you click on advanced search. So if you click on advanced search, it will take you to a page where you can see filters. Now, for those of you who might have used American Fact Finder, to me, this looks very familiar. Here, you have the filters on the left side of the page. And those tables that I talked about before, and the information that I dropped a link in chat for you on tables. If you know the table number that you're interested in or the table ID and made a note of it, you can always type that here in this search box and then pick your geography or the year of the data that you want and go from there, and that will help narrow down your search. If you don't have that, I suggest that you start with your geography first. So let's say that I am looking for county level data, and I'm going to select county data for Nebraska. So I'm just going to pick, Holt again for an example. So let's say these are the counties that I need my information from. So I've selected those and they go into this area here. So it's going to search for whatever you select and is in this area. If it's not in this area, it's not looking for it. The reason that I'm suggesting that you select your geography first is because not all data is available at all levels of geography. And so you're probably not going to be familiar with what's available at different levels of geography. If you select your topics first, and you can do that, but let's say we are looking for health-related information, and I'm looking for health insurance information, but I didn't select my geography first. If for some reason what I've selected as a topic is not available at that level of geography, you're going to get a response that the data isn't available or something similar to that. And you may be confused because you're saying, is it that they don't have the data? It's not available at that level. But if you select your geography first and then your topic or whatever else you're going to select, then whatever comes up is only going to come up is what's available at that level of geography. So then you know if something didn't come up, it's not available at that level of geography. You're either going to have to move down a level or move up a level to get what you're looking for. But at least you know, you kind of get an answer that way. Whereas if you pick the topics and then the geography, you may not know if that's actually available at that level. So I've selected Adams and Holt County for Nebraska, and then I just selected health insurance as my topic. I could, select the years that I want to look at. Maybe I'm doing some historical research and I want to go back and look at a specific year. Maybe I know that what I want, and this is selecting this based on what is here in the box, but I already know that I want it from the American Community Survey. I can select that and be specific, but I'm just going to leave these items here in this box or this area, and then go to the bottom right corner and hit the search box. So here it's telling me that just based on what I selected to search, I have 54 tables. So here are the list of tables. So you can scroll down, you can click on the view all tables. And so then you can just continue to scroll. It'll give you the source of the data, which in this case is the American Community Survey. It'll give you the table ID or table number here, and then the title of the table. It'll say view all 9 products. And what that actually means is what years are available for this particular table. So that will be different for different tables. You'll notice that some say 10, some say 8. So let's say that we're looking for health insurance coverage status by sex and age. So I'm going to click on that table. I'm going to click on the double arrows to move that over so that I can actually see more of the table. So here it's health insurance coverage status by sex, by age. Again, the table ID number, the source. There's a drop-down menu that gives you the different years. So if you want to go back and look at this same table for these other years, you can do that. Across the top, should you decide that you want to add more counties or a couple of cities or the state or whatever it is you're looking for, you can click on the Geo button, and that will allow you to add other geographies, the years. You can add other topics. I do want to mention that at this time, all of our tables are predetermined tables. I know that we're giving the illusion that you're sort of building a table or searching. All of our tables are no more than 3 topics, a combination of 3 topics. My suggestion or hint to you is that you take the 2 top topics that you're looking for. Maybe you really want 4 or 5 different topics, and use those 2 topics to search for the tables, and then scroll through and see what's available in combination with those. But again, there'll be no more than 3 topics. In some cases, you may have to look at 2 tables with the information that you actually need, and have to do some merging of information. But they're all no more than a combination of 3 topics. So I just want to make sure you understand. You can change the sources. You can transpose the tables, margin of error, which this is the American Community Survey. And as I mentioned before, this is a sample survey. So you really need to pay attention to the margin of error and take a look at that. This is completely up to the data user, whether you want to use these estimates or percents when you take a look at the margin of error. But this is something that I like to point out to everyone. You can hide the margin of error. Let's say I had 25 counties that I wanted to look at data for, and I'm just wanting to look at the numbers right away. I could hide the margin of error columns to see more on the browser window. Excel, CSV, you can download the data from the tables. If my hint or suggestion to you is if you find a table that you're going to look at more than once, that you actually download into Excel and save the table. Our data from the American Community Survey is good for 1 year. So every September and December is when we release our 1 year and 5 year estimates. And so the data is good for 1 year. So I would definitely download it so that you don't have to come back and search for it again. You can just look at it and see the data until the new data is released. Another thing about changing from the American Fact Finder to data.census.gov is that we wanted to give you the data in a cell view rather than the table look that you had in American Fact Finder. And so really, this means that when you download the data, it's going to pretty much look exactly like it does on the screen. And so that was something else that we wanted to change. This particular table, because it's health insurance coverage by gender and by age, it breaks it down first with the total for each county that I selected, then the gender, male, and then by age. And these are age ranges. So with health insurance coverage or no health insurance coverage. So as you scroll down, it'll show you the female and then the age ranges and with or without health insurance coverage. So that is this particular table. go back. So let's say that I want to look at more than health insurance coverage. Maybe I want to get a better picture overall of what the county looks like by numbers. I can take out the topic. And so if I know a table number, for example, let's see, I believe, let me try table number D like David, P like Paul, 02. This is a data profile table. So I'm going to click on that. So then this is allowing me to look at DP02 for the two geographies that I selected. This particular table has a lot of information, households, relationships, marital status. Here we have fertility, and that a lot of people will ask why we do ask the question of fertility, and that is requested from the CDC. With the American Community Survey, the way this particular survey is built, we can add or take away questions so that as the population changes over the years, for example, grandparents, we used to not ask about grandparents, but as some of you may know, there are a huge amount of people who are retired or grandparents that are actually raising their grandchildren or caring for grandchildren for some reason. That is a question that was not on the American Community Survey when we started in 2005. And now that is a question that we've been asking for a decade of grandparents. School enrollment, educational attainment, veteran status, and then here, disability status of the civilian non-institutionalized population. And so here with a disability, under 18, there's different age ranges. Where the population of these counties were living a year ago, whether in the same county or the same state, place of birth, citizenship status, year of entry, world region of birth, language spoken at home. Now, this is a topic that may be important to some of you depending on the population that you're working with. Possibly there could be some of that, those in those demographics that you're looking at that don't speak English or don't speak English very well. And so we have a lot of tables related to language. If you're trying to find out about what is spoken in the home, ancestry, and then computer and internet use. Another topic that we were not asking about before, but in pretty much any household across the United States, people will have cell phones now. Very few people have home phones. I'm sorry, I drew a blank, home phones. And so they have cell phones, and they may have access to a computer, and to have those things, they need to have Wi-Fi. So having internet or a computer is very important. We all learned during the pandemic to visit with our doctors virtually, whether on our phones, our computers, or laptops. So this has become a very important topic to ask questions about, and especially for those of us that are trying to reach out to offer a service or some type of assistance to different populations, whether they have access to the internet or some type of computer. So this would give you a good idea of, under these different topics for an area that you're looking at. We have several other tables related. Besides DP02, there's DP03. That has to do with anything related to finances, whether it's employment, income, poverty, anything related, type of work, industry, class of worker, all of those, that type of data is under DP03. DP04 is related to housing. So the number of housing units, the number of people per household, when they moved into that household, how long they've lived there, household expenses, all of that is under DP03, 4. And then DP05, that covers race, ethnicity, and there's one other thing that's covered and I have drawn a blank. So those tables, DP02, 03, 04, 05, if you just want an overall picture of an area, a city, a county, the state, a tract, if you look at those 4 tables, that will give you a really good picture overall by numbers of an area. That covers a lot of different topics in just a few tables. But again, you can get more detailed information for all of those topics under different tables. There are other tools besides the data.census.gov. They're from the survey that I mentioned earlier, the small area health insurance estimates. There's a tool for that. Let me drop that link in the chat if you want to take a look at that. Then for the household pulse survey that I mentioned, that we started collecting data during the pandemic to see how that was affecting the population. I put the link in for that. And then we have another tool that you might want to take a look at. And this is just for COVID-19.